So in this discussion, we're going to be talking about immunology. So we're going to be looking at the immune system and how it works and talk about some infectious diseases. Now, I'm going to make note that throughout this chapter, we're only going to be focusing on some specific infections that maybe don't necessarily fit into any of the other systems per se. There's going to be some other infections and things like that that we talk about within the other chapters. This one's going to just focus on that. Like for instance, like your influenza, we're going to be talking about like in the respiratory system. So it's still an infection. We're just not going to talk about it here within this because we're going to talk about some of the other conditions and also talk about the immune response and how it works and what an individual experiences when they get ill. So just an overview. So we're going to be looking at the physiology of the immune system. What are some signs and symptoms that we commonly are going to be looking at as far as a lot of your general illnesses are concerned? We're going to go through the pertinent exam procedures, just like we're going to be going through with all the systems. What are things you're going to want to be looking for in your screening and assessment? And then again, specific pathologies, which, as I said, in this chapter, we're just going to focus on some, but some of the other infections that we're going to talk about are going to come up within the other body systems that we're going to be looking at over the course of the semester. So when we look at the physiology, we first look at the types of infections. So we have various types of infections that occur throughout. So we have bacterial, viral, we have parasites, and we have fungal infections. So it's important to kind of know because our immune system is going to have different reactions and the different types of infections are going to be treated differently. So when we look at these, there's a couple things to make note. So bacteria do not depend on a host. So they don't need a host for survival, and they could actually replicate independent of a host. So that's kind of a unique thing relative to a bacteria, as opposed to a virus, which can't exist outside of a biological host. So they have to actually use the host cellular mechanisms to replicate. So, and they can't exist outside of a host. So a virus doesn't have that ability to kind of survive without having a host cell. Parasites actually exist in the environment of the host. They still replicate independent of the host as well, very similar to bacteria. So again, they kind of will exist inside the host, but they don't necessarily have to use the host cellular mechanisms to replicate. And then you have fungi, which are dependent on the host for growth, but not for reproduction. And they replicate through what we call spores. So again, all those little differences are going to impact kind of how they affect our body when, someone ends up contracting one of these. So we looked at the whole vector-host relationship. So again, infectious organisms kind of perpetuate themselves by passing from host to host. So the host is the person, or in some cases, an animal that would actually harbor the infection. Many times, a lot of infections include a vector, which is responsible for transmitting the disease-causing organism. So, for instance, very often an insect is a vector for an infection. For instance, if you take Lyme disease, a vector for Lyme disease is a deer tick. Now, we have other things where the immune system actually fails. So we have three situations with the immune system where the immune system can fail. We have immunodeficiency disorders, we have autoimmune disorders, and we have allergic reactions. So immunodeficiency disorders are just that. They're when the immune system doesn't work the way it's supposed to, or basically fails to act. So the disease-causing illness actually suppresses the immune system. We have autoimmune disorders, which are just the opposite. In the case of autoimmune disorders, the immune system is overactive and the body actually mounts an immune response against itself. So what the body does is, the pathology actually causes the immune system to attack normal, healthy cells and tissue within the body. And then you have an allergic reaction when basically normal immune responses will cause damage to normal tissue. So, if you think about your seasonal allergies or, other allergic reactions that individuals have, it's actually going to be a situation where the normal immune response is going to just damage normal tissue from that. And we'll talk about kind of the, some of the physiology and unique things that will happen with that. So as we look here at the components of the immune system, so we're going to discuss the various things that are a part of what we're discussing with the immune system. So the thymus and the spleen. So the spleen we know has various functions. As far as the immune system is concerned, the spleen is responsible for filtering blood and lymph, which we'll talk about. We're going to talk about the lymph system next. It's also responsible for removing abnormal cells and also activating T and B cells. Okay, the thymus is responsible for the production of T cells. Now, with the thymus, so the thymus is usually more active in young children. So pretty much through infancy, through adolescence, the thymus is going to be, responsible for producing T cells. As you get older, become an adult, it does become less active. Again, but it does function to help T lymphocytes kind of mature. So it's helped them to be able to recognize antigens, which is an important part of the immune response. So then we have the lymph system. So the lymph system is essentially we're looking at the lymphatic system, so that includes the lymph fluid, the lymphatic vessels, and your lymph nodes, okay? So lymph is like a clear fluid. It has a lot of white blood cells in it, and it circulates throughout the body and the interstitial tissues. And what the lymph is responsible for is for collecting plasma and cellular debris and reabsorb it through the lymphatic vessels. And you can see the lymphatic vessels basically run, you kind of see them a little bit in this picture. There's a good illustration in your book. They kind of run alongside your blood vessels. And very similar to veins, lymphatic walls are very thin. They have one-way valves to help move lymph in one direction, and they need muscle action in order to do that. So, and then throughout that, you also have lymph nodes, okay? And we have, the picture here showing some lymph nodes, and the figure in your book also shows some of the prominent lymph nodes. And there's prominent lymph nodes in your axillary region, your neck, your groin. There's popliteal lymph nodes. There's supraclavicular lymph nodes in the abdominal region, pelvic area, and in and around the chest. And what the lymph nodes do is they kind of act as little filters for the fluid as that filters going throughout the body. And again, in some areas, even under normal conditions, you could kind of palpate and feel the little lymph nodes. And again, healthy, normal lymph nodes are very small. They're, you could move them. I mean, obviously, and we'll talk about what happens when there's issues related to enlarged lymph nodes. But they're responsible for just filtering that lymph as it's traveling throughout the body. So looking at antibodies, so antibodies are basically the proteins that bind to antigens, which is your infectious organism, and deactivates them. Okay, antibodies are also called immunoglobulins, so that's another term that you'll hear get used. And there's various classes of antibodies throughout the body. And what basically happens with antibodies is that when the antigen triggers your immune response, the antibodies are able to kind of bind to them as they kind of recognize them, and they help to, again, deactivate and start the process of healing or being able to recover from the illness. And then you have the antigen, which, as I said, is basically the substance that triggers the immune response. So the infectious organism essentially is going to have antigens present, and that's going to be what kind of creates then that immune response based upon the infectious organism. And then the other component, you have the complement system. So the complement system is basically made up of proteins. And basically what the complement system, as a part of your immune response, produces various chemical mediators that basically amplify your inflammatory or immune response. So the inflammatory response and the immune response that happens with getting sick is a lot of the things that an individual experiences from that comes from the proteins and the chemical mediators that get released in the complement systems responsible for that. So some of your other components that we look at, if we look at the bone marrow, now the bone marrow is the site for production of both red and white blood cells. Again, the focus here is going to be on obviously the white blood cells. So your white blood cells or your leukocytes, and there's various subtypes of leukocytes that all have different functions and are matured differently. All white blood cells again are going to be referred to as leukocytes, and regardless of the type, all leukocytes are produced in the bone marrow from the stem cells that are present in there. Now, a lot of the white blood cells, so all the white blood cells will be in the bloodstream, and that what'll happen is, depending on the type of white blood cell, they kind of mature throughout other areas of the body. Now, the components that we have with our immune system, it's important to note that the immune system basically is going to have kind of two layers of defense, okay? Your first layer of defense is actually your physical barriers. So if you think of the physical barriers of the body, the skin, the mucous membranes in the mouth, the nose, the digestive tract, the respiratory tract, urinary tract, reproductive tract, that's basically your first line of defense. So if you think about the skin, for instance, any opening in the skin allows for an infectious organism to enter the body, okay? So that's your first barrier, okay? Now, if it gets through that, your second barrier, your second line of defense, is a combination of various cellular and chemical events that happen through the immune system, which has basically two categories of responses, and then within those two categories of responses, they also have other subtypes. So your immune system has both what we call a general and specific response, and then each of those has what we call a humoral or a bloodborne response, and a cellular component or a cell-mediated response. Okay, so you have a general non-specific response, which has a humoral and cellular component, and then you have a specific, or what we call an adaptive response, that also has a humoral and a cell-mediated. So we're going to look at each one of these and just kind of talk about these different parts and what they mean as far as when someone succumbs to some type of to a pathogen or is exposed to some type of infectious disease. So for now, and we'll get into some other further explanation, if we look at the general, or we also call the innate or non-specific response to the immune system, basically the role of that part of the immune system is to help increase metabolism to meet what the demand of the infection. So for instance, the fever portion of that is going to come from this. And again, that's going to depend upon how aggressive the infection is, or what some people would say, it depends on the virulence of the infection, okay? And part of that response, so again, that the general or the innate non-specific will also have a humoral or bloodborne or cell-mediated component. So the humoral or bloodborne component of the general response is your protein complement, which we talked about, okay? So that protein complement is going to be responsible for kind of amplifying the general reactions of the immune system. And then the cell-mediated is going to be the phagocytosis that occurs with your white blood cells, particularly the macrophages and monocytes, where the white blood cells go out and essentially engulf the infectious organism in process for elimination. When we look at the specific response, or what we call the adaptive response, again, has both humoral and cellular components as well. So the humoral component of that, of the adaptive response, deals with your antibodies, okay, or immunoglobulins, okay? So those antibodies will come in and recognize and destroy the infectious organism. Then the cell-mediated part of that involves your B and T cells. Okay, so your B cells, your T cells, okay, or your other lymphocytes basically will produce the cell-mediated portion of this, and those are actually going to be stimulated by antigens. Okay, and then they're going to have the T cells and B cells are going to have different responsibilities. The B cells are going to help produce more antibodies to basically recognize and destroy any type of foreign microbe. Again, that's part of that humoral response. Okay, and actually an example just to kind of show how that works. So vaccines are an example of the specific response. Okay, essentially what happens with vaccinations is B cells remember B cells get produced and they remember the antigens and automatically secrete antibodies. Okay, and then T cells will basically regulate B cell activity, and T cells will also work with the general response. So the key to kind of understanding all the sequences to the immune system is, one, remember where everything's coming from first, but just also understand, regardless where things come from, they all kind of interact with each other. So again, the B cells and T cells are part of the cell-mediated specific response, but they work with the other aspects. Again, as I said, the B cells will help produce antibodies, which we know the antibodies are part of the blood-borne specific response to illness. So that's, remember, get where they come from first and then see how they kind of interact with one another. So again, we talked about the first line of defense. Again, that's going to be your physical barriers, which we just talked about. We're going to look at these other actions a little bit further as I'm talking here, just to kind of review it. Again, your non-specific, your innate, or what we also call the general response. We talked about these. Again, the protein complement is part of the humoral or blood-borne response. And again, that's going to be all those, regulate those chemical reactions as we just discussed. I'm just, kind of going over it again and outlining it differently so you can see it. And then your phagocytosis, or involving your white blood cells, is your cell-mediated response. And then your specific or adaptive involves your immunoglobulins, your antibodies as part of your humoral blood-borne, and your B and T cells as a part of your cell-mediated response. Okay. So again, all of that's going to be important as far as recognizing different types of infections and what have you. And again, for a lot of the adaptive response, so this is an important note for the specific or the adaptive response, it requires the body to be exposed to a substance. And again, that's part of where like immunizations come in. So for instance, when you look at your immunizations that involve deactivated forms of a virus like your flu shot, what basically happens with that is your body, it gets that deactivated virus, so your body's going to produce antibodies and then be able to recognize it. And in this way here, if you're exposed to it or exposed to again, there's various flu viruses, even if you're exposed to a flu virus that wasn't necessarily included within the vaccine, your body can still mount a response, and you might even get sick still, but you're not going to get nearly as sick as you would if you didn't have the vaccine. Okay, so that's an important note. So, and just to kind of talk about some other things related to this. So we've kind of outlined this to kind of show the different parts of this. When we look at the humoral mechanisms or the blood-borne stuff, again, the B lymphocytes are going to be responsible for producing the antibodies. So the antibodies are going to be particularly your specific humoral response. And those are going to circulate. And again, they're responsible for attaching to the foreign antigens and kind of mark them for basically destruction through the immune system. And then your cell-mediated mechanisms, like for instance with your T lymphocytes, they're going to kind of orchestrate the response of various types of immune cells that are going to attack and kill disease cells that they recognize as foreign to the body. So again, the key thing to remember is your B cells are going to help produce antibodies. Your T cells are also going to do various things as it relates to that specific cell-mediated response. Again, a lot of this is going to be based on the contributions of the invading organism. So if you look at table 4.3, just kind of make note of that. It kind of talks about how some of the different immune responses. So I kind of covered generally how the different different aspects of the immune system between the non-specific and specific, how they work. You could kind of just see, I think it's important to see the interaction, so review that table. Again, everything works as I described, it just works a little differently based upon the different invading organisms, okay? And then we look at the effects of the immune response. So obviously, the immune response is going to have effects, particularly on, and again, we're talking, you know, our patient population is active, and if you're in a what we'd call more traditional sports medicine athletic training setting, we obviously have to be concerned with the impact on exercise. So when we look at the effects of the immune system or the immune response, because of what goes on, a lot of, for instance, your strength and muscle proteins could be affected for up to 4 weeks sometimes when you know, depending upon your illness. So if you get a really bad infection, you could have that, you know, be impacted for a pretty long period of time. Again, strength and muscle proteins can be affected for upwards to 4 weeks. When we look at aerobic metabolism, your aerobic metabolism can sometimes maybe even take upwards to 3 months, depending upon the type of infection you have. So that's another important thing to note. So, and again, even if it's not, you know, significantly, you know, even if a person's not, you know, really experiencing significant problems for that long a period of time, it could still take a while to be completely back to normal, even with an infection that maybe didn't have as much of an impact on the person. So this is just a little picture and illustration. So if you think about all of the things we talked about, so you could see they're showing you here. So here's your pathogen right here. So the pathogen is the actual infectious disease. Now the antigen is the little marker on it. So you can actually see how the antibodies, so the antibodies go, they recognize the antigen, and again, they'll look to deactivate it here. Here you have a macrophagy. So macrophages are responsible for the process of phagocytosis. I'm going to show that on the next slide. We actually talk about phagocytosis in therapeutic modalities as a part of the body's healing response to an orthopedic injury. So you still have an inflammatory process. You know, we talked about the inflammatory process when you have an orthopedic injury. So you sprain your ankle, you know, you partially tear a ligament in your ankle, you go through an inflammatory process. The immune response is a similar thing. Now, it's more widespread, obviously, because you're dealing with now an infection as opposed to a, you know, torn soft tissue. So the response is more widespread, but it's still a similar idea. You get white blood cell activity and you get an inflammatory response. And the macrophages are still going to be responsible for phagocytosis. Here you see what are called a natural killer cell. So they're an immune cell that goes around and destroys pathogens as well. Here they're showing an infected body cell, and they're actually showing the interaction with a, you know, what we'd call a memory T cell. So a memory T cell, again, gets us back to that specific response where now if that same pathogen returns, you either don't get sick, or if you do get sick, you experience a very mild illness. Okay, so if it's something that your body's kind of encountered, that's where that comes in. Or in the case of, again, a vaccination where your body can kind of automatically mount that response. So here's phagocytosis. So phagocytosis is actually the process of when the white blood cell or the macrophagy is going to come in and actually engulf whatever it is. So here you're seeing what it actually looks like happening under a microscope, and here's kind of just a picture of it so you could kind of see if that's not clear. But so here's your white blood cell here. This is the white blood cell in this picture, and here's your little bacteria, or, you know, in the case of An orthopedic injury, so if we take it back to an orthopedic issue, if you have damaged tissue, this is like this could be like a piece of a dead cell or something like that. And you see what actually happens. So the leukocyte actually comes in and engulfs the actual bacteria, and then what it actually does is it puts it, so within the cell, remember you have the lysosome, if you remember from our talk previously on the pathophysiology chapter and the cellular pathology stuff that we talked about. Here you have the bacteria getting engulfed. It gets processed and kind of broken down by the lysosome. So that's the process of phagocytosis, and again, that's going to be, again, that's a part of that cell-mediated, non-specific general response to the infection that you get. Again, you'll get varying degrees of what we call a general or a non-specific response and an adaptive or specific response to any type of pathogen that enters your body. So looking at exercise and immune function, we'd already discussed a little bit about, as far as, once you've been sick, kind of the recovery time frame that's involved with that. Again, strength, if you get, ill, and again, it's a fairly, significant illness, strength can remain affected and limited, sometimes even upwards, 2 to 4 weeks, and aerobic function could sometimes take 3 months to recover from if your illness was pretty severe. It's note that as far as exercise's effects on the immune system, so with intense exercise, in the immediate period afterwards, your immune system actually has some decreased functioning. So, and again, this is actually, immediately right after exercise. So we know that from pre-exercise to post-exercise, we do see decreases in markers for your immune system. So like your T and B cells, your circulating level of all of your other lymphocytes do go down, but they do return very quickly. The key with it is that you're making sure that you're recovering appropriately, and moderate exercise is found to be beneficial. Now, that doesn't necessarily mean you shouldn't exercise intensely, and intense exercise over time can be beneficial as well. We just know that after intense exercise, we have that, decreased function within the hours after exercise. However, if you recover appropriately, nutrition, sleep, everything else, that all in all, exercise in general has a very good effect on the immune system. So it actually does enhance your immune system. There's certain situations where exercise will be contraindicated, particularly when an individual has a fever. So that's a worry. So typically, you don't so much worry about bacterial infections. Bacterial infections don't tend to worsen with exercise. However, viral and parasitic infections can, in particular viruses, can kind of migrate through the bloodstream. Like one of the fears with exercising with a virus is you could develop myocarditis, which is a viral infection of the heart. So that could certainly happen. But anytime an individual has a fever, that's something to be concerned about. You just have to realize that anytime you're sick, you're going to get muscle breakdown. There's going to be, the muscle's going to get depleted in order to help fight the infection. Again, it's important to note. But if someone does have a fever, obviously with their temperature being elevated, that would be a contraindication as far as exercise is concerned. So looking at your general signs and symptoms, and again, one of the big things obviously is look at fever. So look at the algorithm in the book to kind of tell you again kind of how to guide with fever. You look at the difference between a high grade and low grade fever. So low grade is anything below 102. A high grade is anything greater than equal to 102. Obviously, if you're looking at 104 degrees, that can cause, cell death and brain damage. And again, there you're looking at the fact that, again, it's part of the body's, ability to try to fight a severe infection. But if you look at that algorithm, it kind of tells you, step by step, if someone has a fever, look and see what your next steps would be as far as how to handle it. As we said, we obviously don't want to, have them participate with a fever. Again, they're already, you'd be having them participate with an elevated body temperature. Plus, the infection is probably bad enough that they shouldn't be competing anyway. Fatigue is very common in a lot of your general illnesses, and that's just because of the metabolism increase. Lymphadenitis or enlargement of your lymph nodes. That would be something that would be, or inflammation of the lymph nodes, which causes them to get enlarged and swollen. That would be something to note as well. That's usually a hint of an infection somewhere. One of the things that you do kind of want to keep in mind with lymphadenitis, if there's any red streaks on the skin caused by an infection, that would tell you that there's the infection's getting into the lymphatic system and causing issues. Again, there's another algorithm there. It's not uncommon for lymph nodes to get enlarged when an individual is sick or even has some infections, like some skin infections could cause that as well. So it kind of just guides you as to how to kind of handle the situation. Any pain, redness, heat, swelling, again, I mentioned the red streaks, so just be mindful of that. Many times that would be something you would see in again, maybe like an infection from a wound or something like that, but that's always indicative of a pretty severe infection. And muscle and joint pain. And the muscle and joint pain is not affected by movement, so that's something you would note. So as a result of the inflammatory process, an individual will start to have muscle aches and joint pain, and that would be something. And again, that's going to be something that does not change with movement, unlike, again, muscle and joint pain that would result from an orthopedic injury. Okay, so for the exam, again, for the temperature, there's all different techniques for taking temperature. You have oral, rectal, tympanic. Your book doesn't talk about some of the newer ways to assess temperature, so we know that now you have the forehead wands, if you will, and the scanners. They all have a certain degree of error and change, obviously, slightly. So normal body temperatures, we all know, is 98.6 degrees. It could there could be a little bit of a range with that, but rectal and tympanic temperatures do tend to be a little higher, so almost by like a full degree Fahrenheit. And again, obviously, oral temperatures could be affected by, like, if they just, if they were just eating, drinking, if they're a smoker and they were smoking. So obviously stuff like that could happen. Body temperature also does vary throughout the day. It tends to be higher in the evening and lower in the morning. It's obviously the lowest when we're asleep. And for women, they tend to have higher body temperature during ovulation. So that's something to kind of keep in mind. Just kind of note some of the technique stuff as far as taking a temperature is concerned, and in the text from the different techniques, from the different ways of doing it. When you do, and this would be important to note, because obviously the gold standard, not so much for when someone is sick, but from what we have as far as taking temperature in the case of heat illness, rectal temperature is the suggested way of doing that. So again, you'd have to use an appropriate thermometer for that. It has to be inserted about 1.5 inches into the anal canal to take that rectal temperature. Note any pus. So this would be something you would kind of note, particularly for like a skin infection. So any type of purulent drainage from a wound tells you that there's a local infection there. So that would be kind of important to note. And palpate your lymph nodes. Okay, so if someone has swollen, inflamed lymph nodes, that's usually going to be suggestive of an infection. And you could usually feel those lymph nodes, particularly in the superficial areas where they kind of cluster. So here's just something that you can kind of look at. Do a disease prevention audit. So kind of look and see. Now, this is actually from an older lecture that was given, but so that's actually not the page number as I'm looking at it right now. There would be a different thing. When you're looking at preventing infectious diseases, actually, so the update would be it's table 4.9 on page 99. Do a disease prevention audit. So without looking at that table, write down as many things right now. This isn't something you have to hand in, but it's just something to kind of keep you engaged with the video here. But write down as many things you can, or like basic things when you look at sports medicine settings that can be done to help prevent disease, and then kind of go back and look at maybe what are some things that you missed or maybe you didn't think of regarding the different ways to help in prevention of disease. So just another thing, participating when ill. So we know that some athletes do participate. Maybe they have like a small infection or a cold. So you say to yourself, well, when do you hold? So we already know that fever obviously disqualifies somebody, but at what point do you stop someone from playing? One of the things that comes out is, and I've heard this from a physician giving a talk one time regarding this. You do what's called a neck check. So this is a pretty simple way to do this. If they have symptoms above their neck, meaning like, they might just have a runny or maybe a little bit of a stuffy nose, maybe a, small cough, things like that. Those individuals, and again, barring that they don't have a fever, they can typically play and be fine, okay? If they have symptoms below the neck, okay, so like chest congestion, things of that nature, that would then more than likely disqualify them from play because it's going to affect their breathing a little bit more significantly as well, in addition to being sick. And then there's obviously the red flag. So again, red flags, we obviously know fever, particularly a high fever is a red flag. Productive cough, severe pharyngitis, abdominal pain. Those would be some things that you'd want to look at and definitely make sure that you, in managing the patient, discuss it with your team physician. Okay, so here we're just going to talk about the different conditions studied in this chapter. Again, make sure you can use the conditions review sheet to get the signs and symptoms down and everything from the text. As I might mention some of them for context purposes, but for the most part, I'm just going to give some background here. So mononucleosis. So here we're looking at a virus caused by the Epstein-Barr virus, which is basically a variant of herpes. It's most common in people aged 15 to 25 years. So, again, this particular illness follows a typical course. Usually there's an incubation period of about 1 month, which is pretty long, but then you get your typical flu-like signs and symptoms. And then the key with this is looking at return to play, and a lot of that has to do with the spleen. So there's some guidelines to make sure that you note as far as the spleen with return to play, because it's very important to note, beyond obviously dealing with the signs and symptoms and maybe some of the lasting effects that someone would have from getting mono. Musculoskeletal infections. So there's some things that actually do affect the musculoskeletal system. So osteomyelitis is a bone infection. So you basically get necrosis and infection of the surrounding bone. This is always a concern, particularly if someone has like a compound fracture. There's always worry about a bone infection, and usually those people are treated with prophylactic IV antibiotics to make sure that they don't get a bone infection. Septic arthrosis is just an infection inside a joint. That could sometimes even happen due to like a superficial skin infection. So that's one of the things that could cause septic arthrosis. And they could also get that from surgery as well as a complication. Autoimmune disorders. So we had mentioned autoimmune disorders at the beginning of this talk. So it's basically any condition where the body's immune system kind of attacks itself and attacks the healthy tissues. So rheumatoid arthritis is when the immune system attacks the joint synovial linings. There's juvenile rheumatoid arthritis, and typically adolescents will get this, and usually the prognosis with this is pretty good compared to someone who's older and gets diagnosed with rheumatoid arthritis. And then there's systemic lupus erythematosus, which is an autoimmune disease that affects various body systems. So with lupus, there's a lot of different things that get affected because this is a pretty widespread disorder. So again, make note of all of your various signs and symptoms and kind of the treatments for all of these individual conditions. Chronic fatigue and overtraining. So when we look at overtraining itself, so overtraining is basically a condition where you have training with inadequate recovery. So we know that with intense training, you also have to make sure you're recovering appropriately through nutrition, through sleeping. And there's certainly things that could happen if someone overtrains. They train intensely every day. They don't get recovery. Part of the complications with this is the increased cortisol secretion. Cortisol is a hormone that gets released as a part of the stress response. So there's various things that could kind of happen with this. An individual could present with varying signs and symptoms. Chronic fatigue itself is usually a diagnosis of exclusion. So usually if someone has like a chronic fatigue syndrome, they'll kind of rule a lot of other things out in kind of treating that. So that would be something that prevents very similar to overtraining. HIV and AIDS. So again, this is immunodeficiency syndrome. So this is where the immune system. So autoimmune is when the immune system is basically attacking the body. Immunodeficiency is when the immune system's suppressed. So again, with this, you want to make sure that again you're following standard precautions with all of your individual patients, because this is a bloodborne disease. What essentially happens with HIV is it impairs T cells, and that's going to obviously suppress your immune system. Usually within about 10 years, an individual develops acquired immunodeficiency syndrome, which is then you're clinically then you're determined to have AIDS. And usually the way they kind of mark that has to do with, they monitor your T cell production, and that kind of changes when someone moves on from having HIV to having AIDS. There's no cure for this. However, they've actually moved along pretty well with antiviral therapy for it. So individuals certainly are not as impacted quite as frequently as they are as they were in the past. So Lyme disease. So here we're dealing with a vector-borne illness. So Lyme disease, which is carried by the deer tick. So you can see in the picture how small ticks can actually be. If you look at that picture of them on the individual's, it looks like their thumb actually. But you see how small ticks can actually be. There's all different types of ticks. I think your book talks about the black-legged tick. I don't know if that's the same as some people call them deer ticks. There's other types, but this is where Lyme disease is typically going to transmit it. In order to transmit Lyme disease, the tick has to be attached for 36 to 48 hours. Now, the thing is, a lot of people don't realize they have a tick on them, until that time. Because again, if you look at that smallest, so if you look here, I mean, this one here, he's pretty small. So if you might not even notice until they're kind of engorged. Now, as they're on the person, they kind of get engorged because they're basically sucking blood from the person. They kind of blow up a little bit more, and then you usually notice them. There's essentially 3 stages of infection when it comes to Lyme disease, and table 4-6 will go through that. So when you're kind of noting your signs and symptoms of Lyme disease, you can kind of see that as a part of your chart for your study guide. West Nile virus. So here I was asking the question, when I would do this in class, I'd ask the question, well, how does West Nile virus get transmitted? The vector from that is usually a bite from a mosquito. So, and usually the signs and symptoms usually begin 3 to 14 days after the bite. Many people actually don't develop symptoms. So interestingly enough, you could have West Nile virus and not even know it, and your body can fight it off and you could be fine. But there's other things, there's more severe illness and things like that can do that. And kind of note your prevention. So I just put up here, what would be some different ways to be thinking about prevention. So at any time there's prevention aspects for any of these, that kind of falls under the treatment. So we'll consider treatment and prevention obviously kind of the same thing, because it's helping limit your exposure, limit your potential for getting sick. So allergic reactions. So we talked about allergic reactions and what they mean. So, again, an allergy is a cell-mediated immune reaction where your body kind of attacks healthy tissue. So you get the release of histamine and chemical mediators. And, many times if you think classically as to what goes on with an allergy, that's where you get like the swelling and whatnot that you have. Again, if you look at the picture here, if you remember from that movie, he eats shellfish, he doesn't realize he has an allergy to it, and he gets the swelling and whatnot in his face. And in severe cases, you end up with anaphylaxis. So anaphylaxis is essentially where, you know, the airway kind of swells up, and then you obviously have a pretty significant emergency situation there. So basically you get vasodilation and smooth muscle contraction. So you get severe swelling in the smooth muscle, and the respiratory tract will actually go into spasm, and the person will start to have respiratory issues. So here's just a picture kind of showing you kind of how it works with an allergy. So here you have a mast cell at rest. So, you know, the mast cell is what releases histamine. Well, here's your cell. So here they're showing the allergen ragweed. So the ragweed kind of binds to the cell, and that's going to cause histamine to get released, and you end up, you know, having, again, what you would experience from an allergy. Now, usually with, you know, ragweed, it's more of what you think of with like seasonal allergies, but those are the signs and symptoms an individual then would experience. Urticaria, or what we commonly will just call hives. So this is a generalized allergic skin reaction. So you can kind of see in the picture here. And we're going to spend an entire chapter talking about skin infections and different things that go on in the skin. But it's worth to note here because this is something that someone would experience with an allergy. Again, any type of physical, mechanical, even psychogenic causes can cause this, and usually it does get treated with antihistamines. I did also want to make note of the fact that with anaphylaxis, obviously note the treatment for that. I didn't have a separate slide for that, but just kind of make note that if someone does suffer anaphylaxis, what the treatment for that would be. Cholera-genic urticaria is a special type of hives. It basically is going to occur due to a rapid increase in body temperature. You know, so things like hot showers, if someone develops a fever, this could cause like a urticaria on their skin due to temperature. We're not quite sure of the pathophysiology of it, but it is something to note if you do notice like a urticaria and you're not sure what the cause was, if they did have some type of rapid increase in body temperature. So here's, again, we'll go back to anaphylaxis. So again, this is the life-threatening immune response. Again, you can think about and note some of the individual causes. So a lot of different things could cause it, and it could cause severe anaphylaxis. Again, the treatment for that is going to be usually an injectable EpiPen. So it's important to make sure that if someone does have a severe allergy to something, that they have that EpiPen available. The individual will still have to go to the emergency room, obviously, but what the EpiPen does is it'll reduce the spasm in the airway due to the epinephrine. There's something also called exercise-induced anaphylaxis. Now, this is something kind of curious, and usually there's going to be predisposing factors here. Usually the person has a history of just breathing problems in general, and they also have chronic use of NSAIDs. So if someone, you know, is overusing non-steroidal anti-inflammatories, that could cause this as well. So again, this is an anaphylaxis that will be caused by a widespread release of histamine, just like everything else. And again, the person will have breathing issues. So and it is essentially an immune response to exercise. And actually, the picture here that I'm showing is a picture of someone who ended up suffering exercise-induced anaphylaxis. You can see, obviously, you can't tell by the picture whether they were having major breathing problems, but in all likelihood they were. You can see the significant urticaria on their skin, and that was caused by that. Insects and bee stings, so again, they could cause either local or systemic reactions. Obviously, the bigger fear is the more systemic reactions in an individual who has a very severe allergy to it. And here you can actually see the administration of the EpiPen. So basically, you basically take the EpiPen and you basically just press it into the outer thigh so that you want to hear a click when you do it. And you hold it firmly against the thigh for about 10 seconds to make sure that the drug gets delivered. So if you know that someone does have a significant allergy to bee stings and they get stung by a bee, you would want to administer that EpiPen, and you want to make sure that you have that on hand. Some pediatric conditions, so just to kind of make mention of some things, and again, some of these with immunizations you don't really see a whole lot, but there's still a chance you could. So with chickenpox, you have about a 2-week incubation. For most older individuals, they probably had the infection at some point in their life, and the infection basically means you have lifetime immunity from it. So, you know, most people who are probably 40 and up have probably had chickenpox because the vaccination wasn't available then. So typically you got chickenpox and you stayed home from school for a while, and then you ended up having immunity from it. But now there is immunization for it. Mumps, which is another viral infection, again, 2 to 4 week incubation period. And again, most younger individuals have immunizations for that. Measles, again, another thing you don't see a whole lot. Again, it has a 2-week incubation period. Like with chickenpox, it does have a rash, and it is contagious until the rash actually subsides. Again, here you have an immunization for that, which lessens the chance that you'll kind of encounter that. And here are your learning outcomes. So again, make sure you make note. So again, as you go back and go through the chapter, make sure you note the signs and symptoms and the treatment, and any situation where there is a particular prevention point. Basically any type. Don't even think of it necessarily, I guess I shouldn't even say treatment, on that form that I gave you to fill out. Think of it more as like a management of the condition would be maybe a better way of putting it.